So, dear medicos, we are having Dr. Pushpa with us, Dan Patnam student, rank 166, 166. Beta, we congrats you for this achievement.
Thank you, sir.
And how you're feeling with getting this awesome achievement of rank 166?
I'm feeling good, sir.
So, beta, let us use this platform to share your success story. Like you are our regular best student. So, what was the experience of that classroom learning in last 1 year?
Yes, sir. I finished my internship in 2021, sir. After that, I joined the regular classes, sir. I attended all the classes face-to-face at the Visakhapatnam Center, sir.
That's great.
Before joining regular classes, I had no orientation about any PG entrance or anything, sir. So right from the basics, I had to learn, sir, how many questions will be there in NEET, how many subjects, everything I had to start from the basics, sir. I had made all my notes in that year, sir. Around January, around last year, there was some issue in my family, sir, some health issues in my family. Till then, I was studying, sir, but I never realized the importance of what a role a doctor plays in the society and also how we can touch life. After facing all that health issues in my family, I have realized the importance, how far I have come, what I should do, what's the importance of studying. But by the time I realized all that, I did not have time to read everything back from my basics. I had to give an entrance, and the last year May I got a rank of 17,000. Then I took T&D course, DAMS NEET T&D course. Then I attended all the T&D classes. One thing I like with the classes, sir, in any exam we'll have few types of questions. Sir. Either they'll be asking concept based, or they'll be asking fact based, or they'll be asking some alien question. DAMS could cater all the needs of these questions. Once we sit in a face-to-face class,
I appreciate the classification. The way you classify the question, that's nice, beta. And before that, from rank 17,000 to rank 166, awesome, beta. This is a great achievement, great achievement. And the point you are sharing with us, the success story you are sharing with us, you had a hard time in your family and you feel proud to be a doctor. Okay, what is the actual role of the doctor? That is very awesome message you are giving on this platform. Beta. We congrats you from 17,000 to 166. Hats off to you. Hats off to you. Great.
Like I classified, sir, the type of MCQ. Attending a face-to-face class will teach you all the concepts, sir. So you can attempt all the concept-based questions with the concepts you learn from face-to-face. And the one-liners, especially your class, sir, you'll teach all the concepts, and then you'll teach how to remember them, how to revise them, and how to recall them in a quick mode, sir. And you'll also teach us how to look for the answer in the question itself, sir. Like BPPV, it is telling you that it is posterior semicircular canal. SSCD, it is conductive deafness. Like that, tips and all I've learned from you, sir. I used to apply it in other subjects also. Like, for example, Anopheles mosquito, Hanophilus. If we read it like that, it is itself telling that, no, I'm not having a siphon tube.
Awesome.
Like that,
I'm very happy. I'm very happy that you are taking my method and you're applying and you are sharing on this platform. Great, beta. Dr. Pushpa, great. Yeah, we should.
Like that.
So whatever subject you take for post-graduation, make a promise that we will follow the same methodology.
Yes, sir. Like that, it used to lessen my efforts to remember everything rather than you can find the answer in the question itself. Like that, I approached for all the memory structure. And coming to the memory type of questions, one-liner questions, this approach, revising fast, that would help, sir. And the alien questions which we don't know, that the best place to learn is the GT video discussions. Every time you will teach, it's like watching a GT discussion is like watching how toppers solve MCQ, but the toppers are speaking out to you, sir.
Great.
Even I used to think they know everything, but they just simply, you will rule out two options and you will come to an answer, sir. Like that I've learned, sir. And one thing
what I'm learning from you, then 17,000 to 166, and you are just giving such light movements. You're giving a strong message to a student. Your stress is there, pressure is there, but we have to crack that pressure. We have to hit this examination with very light mind. No, but the way you are explaining the things, the last NEET was full of LN MCQs. So how was the experience of that NEET? Now coming on the NEET, the students were saying it was very atypical. How was your experience after giving GTs and all those question banks?
My experience in one line, sir, for most of the questions I had some or the other faculty guiding me behind me, sir, telling me that this is the answer. One few questions in some subjects, like I have seen this in my note. My one half of my brain is telling think, but the other half is telling no, you have done it in the class. This has to be the answer. In that questions I went with my gut feeling, sir. But for most of the questions, I felt like faculty is talking to you, faculty is with you, telling on the answers like that.
This is the best part of classroom learning, beta. When you attend a lecture in the classroom face to face, in the examination hall, you feel as if the faculty is standing in front of you and is telling you, beta, mark this question, mark this answer.
Yes,
That's
sir.
that's great, beta. So now coming on the question bank, you were having three set of question bank in DAMS. One was your TND question banks, one was GTs, one was SWT. If I compare the level of MCQs with the last NEET examination, what was your opinion?
My opinion was, sir, means the division of the questions.
Which was the tougher, better, NEET or our question bank, DAMS question bank?
Our question bank, sir. Our question bank is definitely tougher.
And did it help you, better, that attempting those tough MCQs play the role in your success journey of 166?
Yes, sir. That definitely helps, sir. It's like teacher will dig nice holes and put grass on that, and you'll fall into that, and then teacher will teach you how to come out, so that one day in the final exam, teacher won't be there to pull you out.
Yeah.
That day we have to learn. That
So,
I have learned from all the tough questions.
question coming in the last spell, like you attended our DVT. What was the role of that DVT? Because every topper is saying okay, the game changer was DVT. So, what do you
Yes,
feel?
sir. I also have the same opinion, sir. DVT is like it will bring all the important topics into your conscious memory, sir, so that it won't be difficult and time consuming for us to recall in the exam hall. Sir. Every topic, not even complete, but at least the topic will come into our superficial brain, sir, so that it will be easy to extract and think. And many were directly from the DVT, we can say, sir.
So, better and now I will be sharing Dr. Pushpa's opinion on the how we should give preference, or like out of 19 subjects, what do you feel? Like I'm a beginner, I'm starting my preparation from tomorrow morning. Which subject I should give more preference, better? Like after getting this awesome rank, what do you feel? What advice you will give to the juniors?
Sir, if it's for INI exam, we'll
Let us
concentrate.
let us take for the NEET. I have few months, 7 to 8 months for the upcoming NEET examination. So how should I prepare for the next examination?
Sir, first I would advise you to make notes, sir, handwritten notes from the class. Then once the notes is made, simultaneously we'll be learning how to apply that concepts in our MCQs. Sir. And once after some 2-3 classes are over, we can start giving GTs, sir, so that our guessing part improves.
Big
And at
subjects,
the end,
big subjects on one side, medicine, surgery, and short subjects on the other side. What do you feel? What is the role of the subjects? Like which subject we should give more preference initially and in the last spell?
I have no idea.
Role of
Initially,
basic, like you start in the first month. What was your role to the basic sciences, first year, second year subjects, and when you were 1 week before the examination, which subject you give more preference to?
1 week before the examination, definitely short subjects will help, sir.
Okay.
Relatively compared to the note size and the proportion of MCQs, preferring short subjects is better 1 week before the exams.
For the
But
examination.
when we are in the starting of preparation, we should be better focusing on the basic subjects.
Basic sciences. Like exhaustive subjects like medicine, surgery. What was your feel, your experience? What you feel after attending DAMS lecture? Like you were somewhere in this preparation journey. Anytime you feel, yeah, this is less and less amount, less quantity, and it will not be possible for me to crack the MCQ. This type of phobia was there somewhere in the preparation, or you were fully satisfied? Yeah, these notes are more than enough, because after the examination you were, yeah, everything came from the notes. So was there any phobia that we are learning so concise notes and I may not be possible to get a good rank somewhere in the 1 year?
No, sir, I never had the phobia of like the thing which is given to you is less, sir. I was having fear whether I'll be able to apply what was given to me or not.
Very true, very true. Very nice message you are giving all the juniors, because most of the medicos, they have this type of phobia. Okay, we are learning less, it will not be possible. Beta, it is more number of the revision which will decide your rank, not the quantity. This message you should take from Dr. Pushpa, 17,000 to 166. And now she's saying okay, you should be confident. Beta. Like the small tips you are giving, okay, BPV, the P word is visible. These things are very crucial when you are having the pressure of 19 subjects. I think Dr. Pushpa, like you must have attended all these sessions in COVID era and post-COVID. So somewhere a strong message to your junior. What should be the approach post-COVID now?
Actually, I have attended all the classes post-COVID only, sir. Once the lockdown has been opened, I've attended all my face-to-face classes, sir. And TND I have attended live, sir.
Okay.
But 2 subjects I have attended regular classes on the app, sir, like for PSM and surgery, sir. That I had to watch the recorded video, sir. But that subject we took around 2 weeks to watch, which should be complete in just 3 or 4 days in a face-to-face class.
Every topper is saying that the game of 2-3 days were extended to 2 weeks, and that absolutely very
Yes.
true. Very true. Even if you give me the opportunity to like attend my recorded lecture, I will take more than 5-6 days to complete those 2-3 days. Yeah, very true. Absolutely true. And this time management play the important role. When you complete the subject in 2 to 3 days, you get ample time to revise. This is a simple rule of the game. That's simple rule.
Yes.
So like,
I remember,
yeah, you tell me. You complete what you're saying.
I remember you telling us about your anatomy HOD, sir, who completed all the syllabus and gave you time to revise, ample time to revise.
That was like that is the rule of this 19 subjects. So we have to get ample time for revision, beta. Like coming in last session of PYQ, what was the experience of PYQ in your success journey of 166?
Sir, I actually have watched from the PPE kit, sir, while starting my subject itself. I haven't attended the PYQ bar.
So PPE kit what was the experience of that PPE kit bit on eMedicoz app?
PPE kit, it was like which it taught me. I mean, I got to know which all concepts I should not miss at any chance, because everyone will be doing them, right? Those are like must do, and above that it's our choice there. But those are like if it repeats, everyone will be able to do.
Very true, beta. And thanks for coming on this platform. At the last, any special message for DAMS family, beta, DAMS faculty, what role they played other than academics, beta? Now you have talked a lot about academics, not non-academic. What role the DAMS family play for you?
DAMS family is like really a family, sir. For the last 2 years, I have been more with the classes and all with DAMS family only, sir, rather than with Hope. A lot of life lessons, I would say, sir, I have learned from each faculty. How to handle difficulties, how to be smart, how to approach a question. That is from academics part, sir. But what should be the mindset and all I have learned.
That's great, beta. And any special message for your parents, beta?
Yes, sir. Finally, after so many days, I've seen them happy, sir. Right from my childhood, when I knew nothing, they have fought for me, sir, till a particular age. I would say I have done this for them only, sir.
This is their success, and you convey our regards to them. Congrats to them, beta, for this achievement. Thanks a lot. Best wishes, and I want one promise from you. Your sense of humor is very good. Whichever subject you do post-graduation, continue with this attitude only, beta, and just continue, and you will feel your family proud. We are very confident of this, beta. Thanks a lot. Thanks a lot for giving such a honest review on this platform. Thank you, beta.
Thank you.
Best wishes.